Good evening, everyone, both here and in Zoom world. My name is Rick Page. I'm Dean of the Larner College of Medicine, and I'd like to welcome you to this, our 9th annual Health Equity Lecture, held as part of our celebration of the life and legacy of the Reverend Dr. Martin Luther King, Jr. Across the UVM campus, both this week and into next, both in person and online, Dr. King is being remembered for his accomplishments and the enduring promise of his work. As we know all too well, there's much work that still remains to be done to protect and strengthen that legacy and realize his vision for our society. Here at the Larner College of Medicine, we take particular note of Dr. King's statement that, and I'll quote here, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." In light of that statement, this series was established 9 years ago in order to explore matters of health equity within our system of healthcare. So I look forward this evening to hearing Dr. Christine M. Crawford. Dr. Crawford comes to us from Boston University School of Medicine, where she's assistant professor of psychiatry and associate director of medical student education in psychiatry. Her work on disparities in mental health treatment is extensive and impactful. And I'm very grateful she's able to join us here in person this evening to share her insights. I'd also like to thank the Office of Diversity, Equity, and Inclusion for organizing this and other recent events, and particularly thank Tiffany Delaney, director of that office, and Dr. Margaret Tando, Associate Dean for Diversity, Equity, and Inclusion, for all their work today, this week, and over the years. And now, to introduce tonight's speaker and tell you more about Dr. Crawford, here's Dean Margaret Tando. Please join me in welcoming Dr. Tando.
Thank you very much, Dean Page, and good evening to everyone in person and on Zoom. Welcome. I'm very excited for our annual MLK Health Equity Lecture. It's an honor to have Dr. Christine Crawford here today. She is a graduate of the University of Connecticut School of Medicine. She completed her adult psychiatry residency as well as child and adolescent psychiatry fellowship training at Mass General Hospital. And she earned a Master's of Public Health degree from Boston University School of Public Health, where she concentrated in social and behavioral sciences. During her residency, she was the recipient of the MGH Laughlin Award and was selected by the American Psychiatric Association as the APA-SAMHSA Minority Fellow, which provided her funding to develop community-based interventions to reduce mental health stigma within the Black community. Dr. Crawford has a strong passion for using education as a tool for community outreach and engagement, and she has been engaged in a number of community outreach initiatives throughout through the Boys and Girls Club of Boston, the NAACP, and also NAMI. She has authored multiple book chapters and peer-reviewed publications on mental health disparities, Black mental health, and social cultural issues within psychiatry. She has made appearances on numerous media outlets and provides seminars on mental health and racism at various corporate and community-based settings. Please join me in welcoming Dr. Crawford. Dr. Crawford.
Welcome, good evening. I just have to say, what a treat. This really warms my heart to be in front of you guys live and in person. And it warms my heart that you all reached out to me to have me present to give this talk. I really appreciate it, and all of the generosity and hospitality that you all offered today was overwhelming and just really great. And I was just texting my husband just how amazing of a day it's been. So thank you so much for welcoming me and having me here. And I really hope that as we go through this talk, that it just provides an opportunity for everyone to be able to open their minds, to be receptive and willing to learn more so you all can continue to grow and just thrive and be amazing educators, to be amazing people for your friends and family, and also to be amazing clinicians. Because at the end of the day, we really want to make sure that we can serve our patients well and to take good care of them. And it's not just about the clinical medicine, but it's about understanding people. And so I invite you guys to listen to this talk and to hopefully take away one or two things that you can bring with you in your personal lives and in your professional lives. So thank you so much for the introduction. What I hope to be able to do today is to talk about the different forms of racism. We often use the term racism often, but I do think it's important to really be on the same page as to what it really means. So I'll go through the definition. I'm also going to describe something that's called racially based trauma, and I'll talk about the symptoms that we see that are associated with racially based trauma. And I'll talk about all the different ways in which racial trauma can impact the mental health of Black people. And I'm really looking forward to a rich and robust discussion towards the end of this talk and to be able to answer any questions that may come up. So when it comes to the definition of racism, I think it's really important for everyone to understand that it's an organized system. And it's a system that is organized around oppression, and it disadvantages certain racial groups that are designated to be inferior compared to those designated as superior. So when we think about it as this organized system of oppression, you can see why it is we continue to see it alive and well in various different forms. And I think it's important for us to all keep in mind is that it can occur on multiple levels. We're so quick to be able to recognize and identify racism when it's just on the individual level, thinking about that one bad apple who said that one negative thing to that Black person. But it's not just about that. It occurs on the individual level, like I just described, but culturally and rather systemically and institutionally. And I'll go into a little bit more detail about what that looks like. So I like this figure right here because it, again, kind of illustrates all the different levels that we see racism play out. So I described the individual acts, the personal levels of racism. And that's kind of thinking about how are individuals held accountable for their actions, their attitudes, and their beliefs. But it's so much bigger than that. We see it culturally. And what I mean by cultural forms of racism, that's examining and really looking at the beliefs and the values and the norms that we see within our culture. Are some of these values, beliefs, and norms, are they validating and kind of normalizing the white experience? And are they invalidating the experience of those who are of color? So a really great example of this is way back in the day, you would be hard pressed to find a Black doll in a toy store. I remember when my parents would try to find me a Black Cabbage Patch doll back in the 80s when it was really big. It was really hard to find Black dolls. And so on the shelves, commonly you would see white dolls, blonde hair, and blue eyes. And the message that that would send to little girls at that time is this is our idea as a culture, as society, as to what beauty looks like. And because a lot of Black little girls couldn't see themselves in the dolls of the dolls that were on the shelves, it also kind of instilled this belief that, okay, maybe dolls who look like me aren't as valuable, aren't as pretty. And so that's just one example of how culturally we can kind of validate the white experience and maybe invalidate the Black experience, and also have culturally these attitudes and beliefs around what kind of normalizes beauty within our culture. And then also kind of taking a step back and thinking institutionally, really looking at the policies and the practices that are in place that include and serve and uplift and validate white people and thinking about the policies and practices that may exclude or exploit or oppress and invalidate the Black experience or the experience of people of color. So I really hope that this is just one idea to think about how it's not just up to one person here and there, but really it's kind of thinking about how it influences our societies, how it influences our institutions, our policies and practices. Now, there are some other definitions that I like to just provide that are often kind of used interchangeably in this conversation around racism. So just wanted to provide some quick definitions about prejudice, discrimination, and stereotype. So when we think about prejudice, we're thinking about negative attitudes towards an entire group of people. So negative attitudes that commonly come up when it comes to Black people is thinking about negative attitudes such as anger or fear. But discrimination is looking at the behavioral response to prejudice. So looking at the behavioral response of having negative attitudes towards an entire group of people. And so these are the negative actions that we oftentimes see when people are influenced by these negative attitudes. And then stereotype, that's looking at negative expectations or beliefs of an entire group of people. So speaking specifically about Black people, some of the negative stereotypes that we often hear, Black people are dangerous, or they have some kind of character flaw or weakness, or they're incompetent. So having these expectations in mind can certainly influence the way in which you think and act towards an entire group of people. And so, going back to that original definition of racism, when I talked about it being an organized system of oppression that disadvantages some and serves and uplifts other people and kind of has this hierarchy, I think it's also helpful to think about it in terms of this equation that you see here, that racism equals prejudice and power. And I think it's really important to be mindful of this power differential that's in place when it comes to this organized system of oppression and all of these negative attitudes that persist. And that's why it is we see racism continue on. And I think what is really important for us to all be able to appreciate and recognize is that there's so much behind and that lies underneath the surface when it comes to racism. As I've mentioned time and time again, it is so much more than those readily observable various like blatantly obvious forms of, poor treatment and things such as hate crimes that everyone could agree upon are forms of racism. But what I argue is far more dangerous, and I argue that it's part of the reason why we continue to see ongoing examples of racism is the fact that there's this whole iceberg, and we've only been seeing the tip of the iceberg all this time. And there are so many people who are just going along, seeing the tips of the icebergs, but didn't appreciate the rest of the iceberg that was lying underneath the waterline. And these are things such as structural racism, institutional racism, all the different institutional policies that are in place, and the implicit attitudes and the beliefs that are driving all of this. We can't really see that. It's really hard to be able to appreciate it and to be able to observe it. And that's what I hope that we can continue to do with these open and honest conversations about racism so we can really be able to appreciate the full extent of this iceberg so that it doesn't continue to create such harm and damage to people. And so another way to kind of tie all of this together is to really think about the role that implicit bias has on continuing to fuel structural racism. So just taking a step back and trying to better understand why it is we have certain racial disparities that exist, why it is there are certain inequitable outcomes that are there, is to look at history first and to look at some of the policies and practices that have been put into place. So things such as redlining and residential segregation and difficulty being able to access mortgage loans, to live in a variety of different places, led to ongoing residential segregation that we continue to see each and every day. And I tell you, I live in Boston, or just outside of Boston, and we can see ongoing evidence of redlining, that you can go through certain communities, certain neighborhoods in Boston, and it's predominantly Black. And you could see, unfortunately, the infrastructure, the buildings, the roads, you could see that it's not as well built as certain other areas within Boston. And we also kind of see this play into resources when it comes to education, looking at the schools and the types of teachers in the schools. And we're seeing how within certain neighborhoods and communities, it just seems as though they're under resourced, and they have been for a long time. And this has been put into place many years ago because of the practice of redlining. And also thinking about voting rights too. For many, many years, people of color weren't able to vote. And so that allowed for ongoing policies and practices to be put in place. And it wasn't until, if you really think about it, it's quite recently in which people of color have been able to have an active voice in voting, but continues to be blocked. And there are ongoing barriers when it comes to voting and allowing people to be able to access the right to vote freely. And so these are just some examples. But then what ends up happening is when we look at, say, the criminal justice system, and there are certain policies that have been put in place that have led to the mass incarceration of Black people. And when people look at that, they wonder, okay, well, why is it that so many people are incarcerated and behind bars? And why is there that disparity? But what ends up happening with an example, like, say, the criminal justice system, is that we now are then primed to make these assumptions and these associations about Black people. Okay, there are a lot of Black people in jail. There must be something dangerous about them. There must be something about the way they were raised. And this is reinforced by the media. What it is we see in the TV, what we read about in the news. And then that continues to fuel the implicit biases, the unconscious biases that we have, that then kind of inform the policies and practices that people who are in leadership positions continue to put in place. And it continues to contribute to some of these inequitable outcomes and racial disparities. So you could see that it's pretty big, occurs on multiple levels, and it can be really hard to disentangle and to fix. When it comes to COVID, though, I tell you, this was the first time a lot of folks were able to kind of appreciate how structural racism really kind of plays a role in shaping kind of the experience for a lot of Black people within this country. And at the beginning stages of the pandemic, when there was all this data coming out about the rates of Black and brown people who were dying to COVID-19 during the first phase of it, a lot of people were left scratching their heads thinking, why are more Black people dying from this virus than others, and trying to understand that. And this was unfortunately structural racism on full display. And that's why it is we saw a lot of these inequitable outcomes when it came to COVID-19 outcomes at the beginning. And so why was that the case? Now, a couple of things. When we're looking at employment and we're looking at the types of jobs that people of color have, Black people have, we saw at the time that only 20% of Black workers were able to work from home. And this is during the initial phase where we were all quickly transitioning to virtual related work, but not the majority. The majority of Black people weren't able to do it because there was overrepresentation in jobs that were considered to be essential. And so that means jobs such as our delivery drivers, those working in supermarkets, really important jobs that kind of kept us going, continues to keep us going. Unfortunately, we saw significant overrepresentation in those jobs by Black people. And so the reason why this is important to note is that they didn't have the option to stay home and to be able to receive paychecks. They had to go out during a time when there was a great amount of fear, uncertainty about the virus and how it's transmitted, but yet they had to go to work and they had to kind of put their lives on the line. And you can imagine how stressful and how traumatic of an experience it was, especially at the beginning when we didn't know everything that we do know now about COVID. And then also what we saw was that there was an increased rate of transmission from among family members. And Black people are more likely to live in dense metro areas because of residential segregation, as I had described before. But also, there are a number of families of color living within these multi-generational households where you have your 70-year-old child and you have the 75-year-old grandmother. And you're the one who's going out to work at the grocery store. And so there was this ongoing concern about transmitting the virus within these kind of dense households. And there were significant negative financial implications that were felt and experienced by all groups. But what we do know is that Black Americans were almost 2 times as likely to live in counties that really experienced pretty significant economic disruption from the pandemic. And this is some data from the early stages of the pandemic back in April that we did over at Boston Medical Center. And what you could see here in the gray in the blue represents the percentage of people in that state who are Black. And the gray indicates the percentage of COVID-19 related deaths among Black people. So you could see that in a state such as Mississippi, where nearly 40% of the state's population is Black, nearly 70% of Black people accounted for COVID-related 19 deaths at the beginning stages. Why is that the case? And you can imagine if you are a Black person during this time and you're hearing all of this data being presented in the news, in the media, you're yourself losing family members and friends and trying to understand why that is the case. And that whole saga, was traumatic for everyone, but there were multiple reasons why it was particularly traumatic for people of color. And we'll go into a little bit more detail about that. All right, so I've been talking about trauma, I've been talking about racism, but what is racism-based trauma? So I love definitions because it puts us all on the same page. So I want to provide a definition for trauma. Now, trauma is an extreme and sudden violent event that is perceived or experienced by an individual as shocking. And when it's extreme and sudden, it can be intrusive in nature, it can result in emotional numbing, and it can result in an altered arousal state. And oftentimes when we think about violence and we think about something being sudden, we often think about witnessing something really bad happening or experiencing a near-death experience or having a near-death experience. But the thing about the violence, it doesn't have to be physical. It can also be psychological in nature. And what is important is that the individual who experienced the trauma felt as though their sense of self was threatened in some kind of way. And so if an individual experiences and perceives an event to be negative, sudden, and uncontrollable, that's a traumatic event. And oftentimes as clinicians, as providers, as people, we often can invalidate the experience of that person who's been traumatized by saying things like, well, I don't think it was that bad, or I don't think that event really was that big of a deal, or I'm not sure if that interaction could really be viewed as trauma. The truth of the matter is that the individual's subjective experience is valid, and that's the only thing that matters. So if they feel as though they experienced something sudden that was negative, was uncontrollable, and they felt as though their sense of self was threatened, then that's a traumatic event. And we have seen that people can actually present with trauma related symptoms if they experience an event like this. And what I argue is that racism is a form of trauma for a number of people, for Black people, and they also can develop some trauma related symptoms. I'm going to go into different ways in which we could see this play out by using what's referred to as the race related stress model. So, this is thinking about all the different levels in which we could see racism based trauma play out. Now, as a child psychiatrist, I always have to talk about children. And I think it's really important that we kind of look at the experience for our children and our young people because it helps shape and inform the adults that we work with. It helps shape and form who we are today. And it really just kind of gives you a sense of how racism and the stress and the trauma related to it starts at such a young age. Now, thinking about the educational system that our kids go through, what we do know to be true is that Black preschool students, they make up 18% of all preschoolers. However, somehow they account for almost 50% of all preschool suspensions. Now, let's take a step back and reflect on the fact that kids are being suspended from preschool. Whoa, that's scary. But the fact that they only make up 18% but account for over 50% of preschool suspensions, we're talking about 3 and 4 year olds. And it starts that young in terms of them experiencing harsher forms of discipline when they're preschool, right? And looking at their peers and wondering, why is it that my behavior that so and so is doing is being so negatively like penalized? What is that all about? And we see that play out throughout the entire kind of education journey for these children. So, looking at elementary school, middle school, and even high school, what we do know to be true is that Black kids are receiving harsher forms of discipline all throughout their educational years. And we know that Black students are suspended and expelled at a rate 3 times greater than white students. And you could see in this figure that's data provided by the US Department of Education. In the yellow over here, we could see the percentage of students of Black boys receiving out of school suspension. And then over here, you could see that Black girls make up for the majority of students receiving out of school suspensions. So if you are being disciplined harsher than your other classmates and you're receiving out of school suspension, that means that number one, you don't feel like you belong in that school environment because the teacher is treating you differently. You're experiencing harsher forms of punishment, but also you're not in school. So you're not able to access your education. So you're falling more and more behind. And so when you finally land in high school and you have the ability to drop out, we unfortunately see pretty high dropout rates among Black students. And that's because they've been taught at a very young age, unfortunately, from preschool, that teachers view them differently. They view them as being dangerous. They are deserving of more harsher forms of punishment. They experience ongoing out of school suspension. And so when they finally have a say and control over their academics, they make the decision to drop out because they feel like the educational system isn't a system that values them and respects them. And so, also kind of thinking about other ways in which individuals are able to experience trauma and mistreatment on an ongoing basis that can result in some symptoms are microaggressions. And talking about the school environment too, it starts really young in terms of some of the subtle comments like put downs that are made by someone who may not have any intention behind hurting the person that the microaggression was directed towards, but it really can build up over time for that person who's experiencing these microaggressions, such that one subtle put down, one sly comment, they just continue to build up and really can have an effect on you physically and mentally. And so I described to some of the students that I met with earlier about how the experience of being Black in America is kind of like wearing a sticky suit each and every day, where all these comments, all these different experiences, they could just stick with you. And imagine if you're already experiencing that from preschool on. You can imagine how it can have such detrimental consequences for your physical and emotional health. So, what are some examples of microaggressions? And for some, they may not even recognize them as such. But a microaggression in school environment is such as setting low expectations for academic performance of a Black student, or calling on or engaging one race of students while ignoring other students in the class. And also something as what could be viewed as basic or simple as learning to pronounce someone's name and giving the correct pronunciation of that name and continuing to mispronounce the name after the student corrected you is also a form of a microaggression. And also these comments such as, oh, you speak well for someone like you, or you're pretty for a Black girl. It makes you wonder, okay, what was behind that comment? And am I wrong to believe that that was a negative statement? And kind of you get into these battles in your mind about what exactly happened. But to have to navigate that each and every day from a young age is incredibly, incredibly exhausting. And then also, that's part of this race related stress model is something that they refer to as the collective experience of racism, and that being linked to some trauma related symptoms. So, what does that really mean? So, what it is, it involves the perceptions of the effects of racism of on members of one same racial group, regardless of direct personal experience. So, just by hearing about an incident of racism, impacting someone else who's of the same race can have an impact on that person, even though they weren't directly involved. And so it's really important for us to know that if something is said, if something happens, and someone else of the same race witnesses, sees it, observes it, it has an impact on that person as well. One example of this is kind of thinking about the news and how it is that certain Black communities are being portrayed in the media on the news. And that's thinking about who's actually sitting at the table in these newsrooms making the decisions about which stories to feature, which communities to feature. And so we know that back in 2019, only 12% of TV news employees were Black. And so you wonder about the types of stories that are selected, the way in which certain communities are portrayed, and hearing about negative experiences time and time again on the news is traumatic. And I'll talk about that a little bit later. I also want to talk about something that's referred to as vicarious racism and the impact that has on children. And what I mean by vicarious racism, kind of similar to what I just described about the collective experience of racism, but this is more directly thinking about exposure to racist incidents that occur to other people. And what we do know when it comes to the mental health of children is that it really can have some negative consequences. We see lower psychological well being in children when they hear about a friend or a family, a loved one who's experienced racism. We see social emotional difficulties that kind of manifest in the form of increased anxiety and kids walking around with this heightened sense of danger and this sense of vulnerability. And it can also make them feel really sad that this adult figure that they look up to experienced racism or was treated negatively. And we know that children developmentally are rather egocentric and can actually imagine themselves in the place of the loved one, and being in the place of the target. So they're constantly worrying about themselves. Like, if it happened to mommy, it's going to happen to me. Like, I don't feel safe kind of being in some of these environments because of what happened to mommy. And so that's a really difficult position to be in time and time again. And we do know that there's some research that has found that caregivers' experiences with racial discrimination have been associated with depressive symptoms in their children. So it really has this ripple effect whenever it comes to racism. It doesn't just affect that one person who is the victim, but it affects everyone and it affects children too. And we need to keep that in mind. The reason why we need to keep that in mind is because our children have gone through a horrendous time the last couple of years. It has been hard for all children. It really has been. But I would say that, especially at the peak of things in the summer of 2020, when we had all the protests and the riots, the discussions around Black Lives Matters, it was a really confusing time for children because they didn't go on the Black Lives Matter website to read the mission statement and know what it was all about. All they knew was that people were very upset about this phrase, Black Lives Matters. And so you can imagine as like a 7, 8, 9 year old thinking that there are all these people who are angry about saying that the lives of people like you, the people like your friends and family, they don't matter. And that's really confusing. In addition to that, they were experiencing the trauma related to losing loved ones, the trauma related to friends being and caregivers falling ill to COVID, and the significant disruption in their learning, especially with kids who were already in educational settings that were under resourced. They might have already been behind, and this created a situation in which they fell further behind. And this is impacting our kids. And we know that this is such a critical time of their development that we are unfortunately not only having lasting damaging impacts on their education, their learning, but also on their social emotional development and also how they regulate their mood during times of distress. Like it's been really complicated and confusing for these kids. And so, what are some of the actual symptoms that people can experience secondary to race based trauma? And this is, as I have argued throughout this talk, it goes far beyond just that one comment that was made, that one negative interaction. It occurs systemically and is so widespread. But what we see is that for some people, they can experience ongoing, recurrent thoughts, intrusive thoughts related to the trauma that they experience having to do with racism. It can result in an altered arousal state. So, having problems with sleep, not being able to focus and concentrate, appearing edgy and somewhat jumpy, and having variable energy. So you can imagine for a lot of teachers who have kids in class who may be dozing off, who may be not concentrating. Um, Oftentimes for teachers, they don't really know what's going on with these students. They may think, oh, the student is not engaged or they're being disruptive. But really, a lot of these students are manifesting some symptoms of trauma. So it's really important for us all to have this on our radar, not just our educators, but everyone to be more curious about some of the behaviors that we're observing in our kids. And also, we see some avoidance or emotional numbing, such as having memory gaps related to the traumatic event or avoidance of certain places or people that remind them of the event. All sounds like PTSD symptoms, right? So there's been some discussions about looking at the DSM-5, which is our go-to reference book in terms of all the psychiatric diagnoses, and really trying to examine the definition of trauma and traumatic experiences that they have in the DSM. One can certainly argue that racism is a form of trauma that should be included within the DSM because the symptoms present the same, and there's been lots of studies to support this. Also, obviously, having some mood symptoms such as anxiety, depression, and anger. But you remember when I talked about wearing that sticky suit and all these different things kind of staying with you and weighing you down in terms of the microaggressions and all these negative experiences? Well, we see that manifests in the form of high blood pressure, increased heart rate, the release of more stress hormones, and that's all been linked to more chronic medical conditions that we see within the Black community. And so I think it's important for us always to keep in mind children. I sound like a broken record, but I really mean this. It's because when we think about adverse childhood experiences and the studies that they did years ago, looking at the impact, the long term impact that childhood exposure to adversity, looking at the impact that it has on mental and physical health, they were just looking, not just looking, but they really did examine um, children living in a household with someone with a psychiatric illness, experiencing neglect, abuse, divorce within the household, all these sources of adversity. But we have come to learn that there are multiple sources of adversity that have been tied and associated with poor mental and physical outcomes. And racism is one form of ongoing adversity that children experience that can result in toxic stress. Because, as I already described, starting in preschool, if not even before that, children are experiencing kind of these ongoing, frequent exposure to racism, this form of adversity. And when you're constantly facing adversity, it results in activation of the stress response, right? As various stress response systems. And that's why we have an increase in all of these stress related hormones that are linked to negative physical consequences and chronic medical conditions. But we also know that overactivation of these stress systems, it can disrupt healthy brain development. So imagine that all of these experiences, like I just described from preschool, disrupt proper brain development. And it can lead to cognitive impairment in adulthood and ongoing disease. And so this is a figure that kind of further demonstrates that by experiencing adverse childhood experiences such as racism results in disruptive neurodevelopment that can lead to social emotional issues. And then unfortunately, it can result in disease burden and early death. And so, what does that look like in real time in terms of children who have experienced ongoing toxic stress and ACEs? Things that I'm seeing in my clinic, I'm seeing kids who are having learning difficulties, they're inattentive, they're having problems with sleep, they may appear more irritable, or there's an increase in bedwetting. But also, we see some physical symptoms such as headaches and stomach aches and frequent infections. And you can imagine having all of these physical symptoms gets in the way of kids being able to go to school, to be fully present and engaged and learn. So it really does get in the way. So I know that we have some time carved out for questions, but I just want to touch upon um, the events that have occurred over the last couple of years and the trauma related to all of the media stories about Black people being killed at the hands of police. And it was really hard for me and my family, my husband, just constantly turning on the news, constantly going on our social media or checking New York Times or what have you, and just seeing these stories and these images continue to pop up. And what was so difficult is that these people look like my family, look like my husband and all of that, look like me. And so it kind of reignited because I've always had this fear, this kind of heightened sense of vulnerability while being out and about, but it just intensified that because there was so much media attention to it. And it was hard because I noticed that, especially in June of 2020, like I wasn't sleeping well. It was hard for me to concentrate. I didn't want to go into work. It was really hard to be fully present and engaged. And it was because of the trauma that was associated with all these videos and all these images. It really was challenging. And then, kind of fast forward to more recently, some of the court hearings for the individuals who were involved. Um, and I know that this is different from the picture that we saw, but again, this is kind of highlighting um, some challenges with regards to criminal justice system in terms of forms of punishment. And we all had wondered in my family, oh, if this was a Black man, I don't know if he would have gotten off the hook. But it kind of makes us think about this a little bit more, and it's on the top of our mind. And so even though the verdict for these two situations went a different way, it still brings up memories associated with the horrific tragedies and crimes that were committed. And we do know that exposure to the media can be associated with various trauma symptoms. And there's been a number of studies that have shown that repeated exposure to stressful and violent events in the media are associated with problematic behaviors such as increased alcohol consumption, physical complaints, as well as some emotional symptoms. And they did a study a few years back, and they found that just by hearing about a killing of an unarmed Black person by police contributed to 55 million more poor mental health days every year for Black Americans. What does that actually mean? So, what that means is that just hearing the story on the news about a Black person being killed by a police officer contributes to nearly as many poor mental health days that are associated with a chronic medical condition like diabetes. So just hearing about that is associated with poor mental health days. It has an impact on how you think and how you feel. And you can imagine that's pretty tough data to swallow because Blacks are 3 times more likely to be killed by police when compared to whites. So we know that all of these stories that we hear about in the news or stories that people experience within their communities, it really is taking an emotional toll on on people. And this is one example of structural racism that's embedded within the criminal justice system that's allowed this to continue. And so what I like to do is just kind of end by, oh my goodness, that was a lot of information. What do we do about all of this? And I think it's really important that we talk about this, especially to our kids. And they're hearing about this, they're talking about this in the classroom, and it could be really confusing. And I think that as adults, it's important for us to model how to think and how to talk about some of these really difficult topics and to be open and honest about how racism and trauma is affecting you and how it's impacting you, and what it's like for you to hear stories about people from different communities being impacted by racism, and share with them what your emotional reactions are, because we all should get emotional about this happening. And for a lot of kids, if they don't see that their parents care about it, then they may not care about it, or they may not learn to care about it. But what is so true to know is that racism affects us all. And we all have a shared sense of responsibility in addressing this. It's not just for the people in that community who are directly impacted and experience it each and every day, but it's for all of us to better understand, to discuss, and to figure it out. And the only way we could do that is to have conversations about it rather than ignoring it, rather than turning a blind eye to it, because we really want to have kids with a working framework for how to navigate some of these challenges. And also for parents to think about limiting exposure to the media for themselves as well as for their children because of the emotional toll that it can have. So thank you so much for having me. I really wanted to make sure that we have some time for from questions, but I really appreciate that you all are here to educate yourself. You all are open to listening and allowing for these discussions to take place. So I just encourage you all to continue to use your voice and feel empowered to ask the tough questions. Help me to understand why it is that patients of color, have different outcomes, or help me to understand why it is you made that comment earlier when we talked about this patient. And just continue to be curious, and that will allow people to kind of reflect on their own practices, their own beliefs, their own attitudes, and hopefully make change. So thanks. Hello.
Wow, thank you very much, Dr. Crawford, for that incredible talk. Yes, that was a lot of information, but very helpful information. So we'll be open for questions now. The first question I'm getting through from Zoom is, what is your advice for educating and having conversations with those who may not understand the effects of racism on mental health and health outcomes?
Yeah, so I think that when it comes to having conversations with people about this topic, we often feel this sense of urgency to convince someone to take a certain stance on a particular topic. We feel this sense of urgency to convince them right in that moment that their thinking is wrong and that our thinking is right. And the way that I think about it is that people are adults, they have their own attitudes and opinions and beliefs about things. But what we can do is we can plant the seed in their mind to think differently about a given topic. It takes up too much energy to fight and have these arguments, but to just plant some seeds that they can think about, that can kind of be part of their mind, that they can file away, and hopefully over time as they go through different experiences, it can kind of water that seed so it can grow to something that can change their opinions, their attitudes, and the way they navigate the world when it comes to some of these topics. So that's the way that I view some of these interactions. When it comes to the mental health effects, I think it's helpful to just talk about how a person's subjective experience is valid. And so if someone says, oh gosh, I'm really anxious about being around the police, or I'm anxious about being in a space that is occupied by predominantly white people, instead of saying, oh no, you shouldn't feel anxious. Everyone's so nice and welcoming. But instead, be curious about what is driving and fueling that anxiety. Oh, goodness, I'm so sorry to hear you're anxious. I wonder what's behind some of that anxiety. Do you mind sharing with me? And what can I do to make the situation a little bit more tolerable? So rather than making assumptions and kind of impressing yourself upon the situation, to take a step back and to understand what the person is going through, and maybe even get an understanding from them as to what can be helpful.
Thank you. Thank you very much. Another question is, what level of exposure should be provided to kids and parents regarding these traumatic events in the news? And how do you draw the line between staying informed and overexposure?
Yeah, great question. Because we live in this society in which we're constantly exposed to news. We have cable news networks that are constantly replaying images and headlines. We have kids who are on cell phones and they have alerts about things that are popping up, these various notifications. So I do think that it's important for people to stay informed, but I do think that having set times in the day in which you check the news, read social media can be really helpful, so that you're not kind of flooding yourself with all this information. And so, one thing that parents can do is to watch the news or go on social media together and have carved out time each and every day, or if it's just on the weekends, but time set aside where you can review some of um, that content together, so you can have conversations about what it really means, how it's impacting you, and you can have a conversation about strategies that the kid can use to kind of navigate some of these difficult topics. And I think it could be helpful because it can be overwhelming to constantly be exposed to it. So just limiting exposure can be helpful, but having time to discuss it as a family is good.
Dr. Anderson, did you have a question? I was just wondering. No, but I have more questions. I'll keep going. Zoom. If people in the audience have a question, I can. Okay. Here, let's. Can you hold it? Yeah, you're gonna need a mic. You need a microphone. Yeah.
So thank you very much for your talk. I have to admit, I am quite concerned. I have two cousins living in Boston, a 12-year-old and a 15-year-old. And the 15-year-old is from what I can tell, I'm not a psychiatrist, having, dissociative symptoms, memory loss, lack of interest in school, in 10th grade, and just like, well, I've just got 2 more years, I'll finish. It doesn't matter what happens anyways. I mean, serious borderline depression. And I've spoken to her about seeking counseling, but are you thinking of any way, at least in the Boston area, bringing together kids who really are seriously manifesting these kind of trauma symptoms, and any kind of group therapy? Is there any mechanism that is possible for kids in Boston or in other places that you're aware of?
Yeah.
I mean, I'm talking about specifically getting people together to support young kids who have experienced race-based trauma.
Mhm. So a couple of things. One thing that they're doing in Boston is that the Boston Public Health Commission has hired a number of clinicians to be embedded within the schools in Boston to provide individual counseling to kids. And what's really interesting during this period of time of the pandemic, because they couldn't see people in person, they were talking to them on the cell phone, but more interestingly, they were texting with them. And you can imagine for a lot of these kids who were stuck at home, there wasn't really a place for them to have any privacy, to be able to talk openly about what their emotional experiences were like. So they were texting back and forth with their clinician. And that's something that continues now, even though some of the students are back in person. The other thing that they've been doing in Boston, there's a church called Roxbury Presbyterian Church. And once a month on a Thursday, they have a trauma group in the basement of the church. And the way that this group is set up is that it's almost set up like an open mic night where there are mental health clinicians who are there, but it's really led by the pastor of the church. And people come up to the mic and they share their stories of trauma, how it is that they're processing the trauma. They don't go into exquisite detail, but they talk more about the emotional experiences about it. And to have a space where other people can validate that experience, other people who are from the same community in which they've been impacted by community violence and whatnot, and to be in a space where people they know are going through the same thing can be incredibly uplifting and validating. And to have it integrated with their faith too is really impactful. And so we have some clinicians who are there to provide some additional support. But it's really tough. I also tell people to talk to their pediatricians about some of the mental health related changes that they're seeing, because I tell you, the pediatricians are the front line workers when it comes to the pediatric mental health crisis that pre-existed COVID, and it's only gotten worse during this period of time. And so I just encourage people, any subtle change that they notice, to not delay, to not just chalk it up to normal teenage behavior, but to talk to the pediatrician about it to see about getting some support.
All right, Dr. Farsi is asking, can you comment on healing spaces that support Black mental health that are outside the medical system? What models have your patients accessed and found helpful?
Yeah, so kind of talking about faith-based communities, because within the Black community, oftentimes people feel more comfortable going to their church leader to talk about any mental health related challenges that they have. Because the stigma of mental health is so huge that they don't really feel comfortable talking to a psychiatrist, someone that they don't know, or a therapist, but feel a lot more comfortable talking to their church leader. And so there have been a lot of different projects that have been put into place to provide education and training to church leaders on how to respond to conversations having to do with mental health concerns from the congregants. And it's been really powerful because there's so much conversations about in the Black community, if you're experiencing depression, anxiety, well, just pray on it, just believe in God, put it in God's hands. And you can do that. And at the same time, you can get more supports, more mental health supports. And so it's really nice that the faith based community is having those conversations yes, we'll pray on it, we'll put it in God's hands. And I do know that talking to someone at Boston Medical Center could be really helpful. I met with this person before. They're great. Here's their number. So that's something that's been pretty active.
There's a question in the audience.
I really enjoyed your talk, and I'm thinking about the slide that you were talking about. Racism could be individual and then institutional, and that's been an interest of mine, looking at institutional racism. And so, what I was wondering, your thoughts about the sometimes we think that institutional racism is invisible, as you were saying. It impacts us, but we don't understand the structural nature of it. Well, I was wondering, what do you think the impact when it's now very visible? And if we're seeing, what are the messages when we're seeing like voting, something as basic as voting now being denied? And how do you explain that to a child? Some of the things that we are now seeing, it worries me what messages children are hearing, because having grown up in an era where voting rights was what I heard growing up a lot, and we really had to fight for voting rights, and we made this progress, and children are hearing it now from Congress. I mean, and so I was just wondering, is there any insight about this visible kind of institutional racism and what messages it gives to the Black community, but particularly to our children?
I really appreciate that question and comment, because I think what's challenging is that when people look over the course of history, they say things like, so much progress has been made. We've come so far. Things with regards to racism are different. They are better. Things have improved. But I could tell you, just based on the work that I do with children and adolescents, is that I feel as though this time of growing up during this time period has a tremendous negative impact on young people's mental health, because it's no longer hidden. People are just blatantly and openly racist. And I think what's hard is that there's no shame behind it now. And people are no longer as careful about their words. People feel emboldened to having conversations about how Black lives do not matter, or how it is that certain groups shouldn't vote, or how certain groups should be sent back. Just the type of conversations, the language that is being used, is just so harsh, and it's really difficult for kids to navigate and understand. And so I think what is important for a lot of kids to keep in mind is that even though kids are part of systems in which adults are supposed to be taking care of them, right? We think about some of the leadership, the school administration, and how they may have some vocal thoughts and opinions, to ensure kids that within their family, within their own little bubble, that there is support. And I think it's important for kids to know that they are being seen and that they are heard. And the only thing that there's a lot more we could do, but I feel like as a community, we need to make it such that they feel like they are loved, that they are listened to, that we care about their emotional well-being, but to acknowledge and recognize that what is happening in the outside world is wrong. And so I did not give you a satisfying answer, because it's something that I continue to struggle with each and every day, especially having two young kids. Like, how do I explain this? The fact that like my grandma went through this, I'm going through this, and there's a concern that they may too. Yeah.
There's another question from our Zoom chat. It says, I'm wondering if there are good trainings or resources for healthcare practitioners to learn more about treatments for patients who have experienced trauma, or working and connecting with patients who have experienced trauma.
Yeah. Great question. I don't have any specific trainings to guide people to, but I do think that um, I can send an email with different resources in terms of different readings that people can do. But I think that it's important for people to, I'll take a step back and just kind of put in a plug for this. Oftentimes, when it comes to people wanting to learn more about trauma, wanting to learn more about racism, there's this desire to kind of approach their local Black friend to ask all of the questions. So I appreciate the question in terms of wanting to learn about trainings and resources, but yeah, I think it's more about just doing individual readings, being curious about the patients that you interact with, about their direct experience. So sorry, I can't name off training off the top of my head.
Do
Mhm.
you know if NAMI being the National Association for Mental Illness, right?
Yeah.
Like that could be a resource for?
So NAMI is a great resource. We've had a number of different panel discussions, a number of different conversations around racism and the impact on mental health. So there are a number of different webinars that NAMI does have. There's one posted on YouTube. If you were to Google or YouTube NAMI racism, mental health trauma, there's something that does come up. So we do talk about it in NAMI.
Okay, what is your advice for clinicians of color balancing being both an advocate for their patients and also experiencing racism in the healthcare field themselves? I think this is a great question.
It is a great question. I kind of want to hear your answer. I love to hear other people's thoughts about this. So advice that I have is it's important to not only advocate for your patients, but to advocate for yourself too. Because oftentimes, especially providers of color, can feel an incredible sense of burden in terms of kind of navigating the complexity of their work environment, but also feeling this desire and this sense of urgency to protect and support their patients of color. And so, what I suggest and what I've been trying to advocate for is to take care of yourself first because burnout is for real. And what we're seeing, especially with clinicians of color, they're burning out. And if they're burning out, they're not able to be there for the patients. And it's not to say that patients of color can't receive good care from a non provider of color, but it's so important too for the workforce to be alive and well. And so if you notice that you're experiencing some of the symptoms that I just described in terms of not being able to sleep, you can't concentrate, you're not looking forward to work, you're dreading work, then perhaps taking a step back, having a personal day, mental health day to reconnect, to reset, but also to talk to your leadership and supervisors about what it is you can and cannot do. And if you feel like the workload is too much, to be vocal about it and just say, I'm a great provider, I know I'm excellent, and I'm tired. And so both can be true. You can be an amazing provider, but also you're human. So knowing how to kind of put on your oxygen mask first so that you can be well enough to advocate for your patients.
Thank you. Any other questions? Oh, yes.
Hi.
Dr. Rosen has a question.
I like how I'm getting closer. and
I know,
closer.
I know. She does.
Thank you so
love
much for this excellent talk. I wonder, this connects a little bit to the last question, but I wonder if you have thoughts about how we can effectively support in the context of trauma, racism-based trauma responses, how we can support our medical students of color.
Yeah, great question. So I think a couple of different ways. The first is to make it such that we're not continuing to burden our medical students. So if there is something that happens that has to deal with racism on the campus, to not quickly pivot and look to the Black students to be the ones to kind of lead the charge on the response, on the discussion, on the community, in the community about what had occurred, because everyone processes and experiences trauma in a variety of different ways. And so for some people, the way in which they process is to be able to talk about it and to have areas and spaces in which they can discuss these things open and honestly. But then there are also people who don't want to talk about it because that is traumatic in and of itself. And so I think that, again, just providing a space, saying our Office of Student Affairs, we're welcoming and we're willing to have these discussions, and we're willing to provide whatever resources and supports that are needed, but to not inundate them and flood their inboxes with messages about, we're here to support you, we're support you. Like, we get that, but also we need to see it in practice in real time. So what that looks like is starting a talk or seeing a med student on your clinical rotation and just saying, my goodness, what happened to so-and-so or this incident, my goodness, that was really upsetting for me. And I just want to kind of call out the fact that, that was racism or what have you. Just by having a conversation, kind of naming it and bringing it up, just really kind of sends the message and signal that you're thinking about it, that it's impacting you, that you have an emotional response to it. And I think that can be quite validating. So basically, just talking about it, start a class with it. My goodness, this is ridiculous. Start an interaction with it, but don't expect the student to lead the discussion and kind of take it away.
All right, we have another question on the audience.
Hello, hi. My
Hi.
name is Harley Rodriguez. Thank you for coming. I think we need more people like you to come to institutions, major institutions like this one. And I'm a recent, I guess, resident of Vermont. I'm
Yeah.
originally from the Bronx, New York, and it's pretty interesting to come here and live here in Winooski area. It's more of the diverse area. But my question is more about because you answered a lot of my questions, and also the people that asked questions here answered a lot of my. Asked the questions that I was gonna ask. But it's really specific. I don't know if you have answer to it, but I started working at the medical center, and I've noticed that of all places, diversity is really in the medical center in UVM because of the travelers and also the refugee population in Winooski. I wondered if you ever worked with refugee communities and if how because even though I'm not African American, I am of Black ancestry. I'm Dominican American, and I'm aware of all the like when you reference the microaggressions. I go through that every day here. Obviously we all in Vermont, and so my question is, how can I better support refugees that like my coworkers and make them aware of like things that they could see and microaggressions that they may hear. And maybe they don't hear and they're not aware of it. I don't know if you've worked with them. And also my second question, sorry for the question. I'm really interested in pursuing psychiatry one day. I wanted to know your thoughts about how important it is for diversity and inclusion in psychiatry. I recently had my identical twin brother passed away of severe mental illness. So this lecture like really hits home to me, and I came here like kind of like in remembrance of him, honoring him. But also I'm gonna try to keep on going to events like these so I can become more aware of these things and like how I can become a better advocate and stuff. But anyways, that was a long-winded question. But I just wanted to know your thoughts on that.
Well, I really appreciate you, and I appreciate you being here, especially in the memory of your brother. And I'm so sorry that you experienced that loss. And I imagine the experience of seeing him living with severe mental illness, which is something that really deeply and profoundly impacts the individual, but the families too. And it's often a condition that is left out of the general discussion about mental health, We often talk about depression, anxiety, and PTSD, but we rarely talk about schizophrenia, schizoaffective disorder, bipolar disorder with psychotic features. So thank you so much for coming here and your interest in psychiatry. But with regards to your last question about, in fact, I forgot your last question, but I'll go back to your first question. I'll remember the last one. So in terms of the refugee patient population, when I talk about microaggressions, the same things apply for all different groups, right? In terms of an approach that can be used. Is my mic still working? Yeah, okay. So one way, there are a number of different approaches that one could take when it comes to challenging microaggressions. My approach that kind of sits well with my personality style is to ask questions. To ask questions like, well, I'm curious about why it is that you only spent 2 minutes with that patient, but with the other patient, you spent about 15 minutes. Like, I wonder what was behind that decision, or I wonder about why it is that you selected this particular medication and you didn't for this other patient. Was there anything that kind of influenced that decision? And I hope that within this community, people feel comfortable enough to answer those questions and to be able to reflect rather thoughtfully, or to call out what it is that you see. So if you see that there is mistreatment, to be like, excuse me, I wonder about that approach you had interacting with that provider. It seemed inappropriate to me. I'm curious about your thoughts. And it could be really hard, especially when there's a power differential, to question someone who's in a position of authority. But there's a way to ask questions and to question people in a respectful manner that allows for a dialogue. And so that's my approach, because I think that oftentimes when we call people out and say, that was awful, that was terrible, what people walk away with and may remember from that interaction is how you made them feel and how you kind of projected yourself and whatnot, rather than using it as an opportunity to learn and grow. And so that's why I like to create these spaces to engage in dialogue, because I think that has a more lasting impact than walking away from an interaction being like, whoa, that person got heated, yikes. And then your other question about the importance in psychiatry and of racism and trauma in psychiatry, yeah. So I think it's important because there are a lot of people who don't realize that experiencing racism can contribute to mental health related symptoms. And there are a lot of clinicians who don't realize that too. And so I do think that it's important for everyone within the field of mental health to be able to appreciate and understand that all of these different experiences in terms of microaggressions, the way that people are portrayed in the media, the different conversations that are taking place, they have an impact on how people think and how they feel each and every day. And they may go to see their mental health provider and not feel comfortable kind of disclosing what is kind of driving some of the symptoms that they are experiencing. And so if more clinicians can be mindful of these things and ask the questions, I see that you're not sleeping well, you're not eating. I wonder if there are things that are contributing to that. What do you make of what it is that you're experiencing? I wonder if anything has to do with race or any other forms of trauma. And just mentioning it, again, it kind of plants the seed. Oh, okay. I guess they kind of know about this and they're willing to talk about it. So that's one approach.
Wow. I want to say thank you to Dr. Crawford. This has been incredible.
Thanks.
So glad to have you here as our 9th MLK Health Equity speaker. I want to thank all our participants that are on Zoom that couldn't be here in person, and I have a almost full room here of very important people that are also here, and I want to thank you. This would not have been possible without the fantastic help of our IT team and my incredible office staff in the Office of Diversity, Equity, Inclusion. And of course, without the dean's support, none of this would become possible. So I really want to thank everybody for being here. And Dr. Crawford, I hope you felt welcome in Vermont. And
yes.
I'm hoping we can steal you.
Yeah, I mean. Thanks for being here. This was fun. Thanks.